segment of the show for today. The topic is World AIDS Day Outreach, and we're talking to Ms. CWyatt-Morley and Mr. Buddy Stewart, both of the organization WOMEN. Before we had our final commercial break, Ms. CWyatt-Morley and Mr. Buddy Stewart, we were talking about some of the things dealing with this disease in terms of it being a disease that has impacted the world. But let's look at Nashville, Tennessee here, and where the two of you do most of your outreach work. And to have you, the two of you, talk about the kind of support that you think that you find within the community, and the kind of support that you need in order to provide the kind of education and resources and whatnot that are necessary to have some kind of impact upon this disease here, not throughout the world, but what do we do here?
Right. Well, we are a nonprofit agency. Women on Maintaining Education and Nutrition has been nonprofit status since 1997. And being nonprofit, we are always looking for support. We're looking for dollars. We have programs that are in desperate need of financial backing. We have a program called Full Plate, where we feed individuals. We have a program called Used Threads, where we give away clothing. We have several underfunded or non-funded programs that we really could use the audience's support, financial support. And we are in Nashville. We're on the street doing street and community outreach every day. We're in the trenches seeing these people right in the heart of Nashville, and we definitely need financial support, in-kind donations. One of the biggest needs that we have today is the need for a van. We need a van to transport our constituency from place to place. They can't come into the office to get the services that they need because they don't have transportation. So we are in desperate need of a van, and that's just one of the things that we need. You want to tell them about some of the other needs that we have?
Oh, there's always a lot of needs, and it's important that you know your resources, okay? Because when you go out on the street, and when you do come across that one person who needs help, and when they come to you, they expect for you to know right then and there. You can't hesitate. You have to know right off the bat.
If an individual needs housing, for example, you've got that's a resource.
If you need housing, transportation, food, medicine, you name it.
Doctors,
exactly. Whatever, we can provide all that.
Those are all the resources that are
right? So with no hesitation, you know what I used to do. I just refer everyone to our office because we have a connection where we can just make a phone call, and we tell the patient, now we did our part, now you need to do your part. But the most important thing, we want to encourage them, not to give up. There's always hope, and so.
What about those who might need medicine or whatever? Is it's also possible to get medicine?
Oh yes.
Well, we have connections to some of the infectious disease specialists in the community that we trust and feel very comfortable with, and link our constituency with them immediately. But I must admit, a lot of our constituency are already in tune or in touch with their infectious disease specialists. One of their major concerns is having someone to talk to, having transportation to get to their infectious disease specialist. Again, we talk about the van. The needs that the agency has are extremely large, and we do need the community's backing. We need the community's support, both in kind and monetarily, to do the things that we can do for our constituency. And a lot of them, as I said, have contacts with their infectious disease specialists, but some of them are off Medicaid or off out of the system and don't have access to get the drugs. Well, we need to try to assist these individuals to get on their medicine, be adherent to their medicine, because as we know that it's extremely important that you not only are on the medicines, but that you take them consistently. Well, when you have to worry about whether or not your children are going to eat versus whether or not you're going to spend money on medication, which one will win? Your children will eat.
But also, if we do get a patient back into the clinic, they have no insurance, we have a way to get them on, get them insurance. Also, if they need medicine, there's a program through the state, just a phone call away, and all the medicine is taken care of free.
And so in a real sense, the attitude has changed considerably about this disease over the last 10 years, and that any person who might be affected by it can find some kind of support and some kind of help in almost many areas. And I don't think that that's something that many people recognize in terms of dealing. Well, as we end this show today, let me thank both of you, and to give you an opportunity to make a 10 or 15 second comment before we end it. But as we said to you earlier, Ms. CWyatt-Morley, that we appreciate your courage coming by and doing the things that you've done, and we know that this publication is a widely respected and well-known publication, and that it is one of the sources that you use in order to support what you're doing. And I think that you've indicated that you have a need for a van. Well, I'm almost sure that with the things that you're doing and the kind of activities that you're involved in, that there will be some method through grants or whatever, so that you can one day be able to use that van to get in touch with your clientele. And so let me thank the two of you for coming by and giving us that excellent information about World AIDS Day outreach. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.